Good morning, everyone. Myself, Amrita Patil, Assistant Professor and member of Women's Cell, Bharati Vidyapeeth College of Engineering, Pune. I welcome you all in today's expert talk on the topic menstrual health and hygiene. As you know, an objective behind the formation of Women's Cell in the institute is to create and promote healthy, positive environment for girls and to motivate and encourage them to attain their professional growth by keeping balance with personal health and hygiene. With this little start, I request Professor Kavita Kulkarni ma'am, in charge, Women's Cell Bharati Vidyapeeth College of Engineering, Pune, to introduce chief guest of today's expert talk.
Thank you, Patil madam. Good morning, everyone. Good morning, Ankita madam, and welcome to Bharati Vidyapeeth College of Engineering. It's my pleasure to introduce our guest, Ms. Ankita Sukhwai, CSR Executive, Unicharm India. Ms. Ankita Sukhwai, Executive CSR, has been a part of Unicharm India for almost 5 years, where she is handling the program implementation on menstrual health and management. As a core team member of the CSR team, her role involves training and development.
Hello, Kavita ma'am, you are not audible.
She holds an experience of conducting more than 500 community training with adolescent girls and women on menstrual health and management. She brings an experience of working with some of the international not-for-profit as a community mobilizer on health issues. On her academic background, she holds a master's degree in social work with specialization in child and women welfare. May I request Ankita ma'am to please start her session? Ankita ma'am, are you there? Ankita ma'am? Patil madam, please make Ankita madam as an organizer.
Actually, she was present, but right now she left the
She's
meeting.
there, but she's as an attendee,
Okay,
she's there.
fine. Okay, ma'am. Yes. Yes, ma'am.
Ankita ma'am, can you start your session? Hello? Ankita ma'am?
Hello.
There is a problem on from her side. Just wait for 2 minutes. Hello, Ankita ma'am, can you hear us? Ankita madam? Hello, Ankita madam? Hello, Ankita madam? Ankita ma'am, can you hear us? Hello, Roshni madam? Hello,
Yes, ma'am.
madam, you can start.
Okay, okay.
Yeah.
Okay, so good morning, everyone. So sorry for the technical issues. So Ankita here would have been taking the session, but due to some technical issues, I'll be taking the session. So I'll be presenting my screen. Just a moment. Okay. So is my screen visible to all?
Yes, ma'am.
Yes, ma'am.
Okay. So before
You are not audible, ma'am.
Ma'am, no audio.
Hello, Roshni madam? Hello, Roshni madam.
Okay, sorry, I think I got disconnected. So am I audible now?
Yes.
Okay. So throughout the session, I'll be asking few basic questions to all the participants. So it would be easier for all of us if you could respond. We could understand about the topic, and it would help us discuss about the topic. So it is not as a lecture form that only I'll be speaking. So it is an interactive session, and which is giving us all the opportunity to talk about the subject. Okay. So to introduce myself and where I'm coming from, on the screen present to you, there is a name written Unicharm. So is the name Unicharm familiar to all? Have you ever come across this name earlier? Okay, so I guess all the participants are on mute. So participants, you can write it in the chat box option. It would be really helpful. Please do use the chat box option, write your responses over there. Ma'am, I think even the chat box
Yes.
option.
Yes. It's not only for the presenters chat box and mic is available. For others, this.
Okay,
It's
not a
not.
problem.
Yeah.
Okay. So to introduce what is Unicharm. So Unicharm is a Japanese MNC. It has started out in India since 2008. And since then, it has been manufacturing the products Mami Pocopan diapers and Sophie sanitary napkin. Apart from that, it also manufactures adult pant style diapers under the brand name of Life Free. So, and these are the three basic products which Unicharm has been manufacturing in India. And I am Roshni. I am from Unicharm CSR department, the Corporate Social Responsibility department, wherein we organize sessions on menstrual health and hygiene management across various educational institutions. So to begin again to coming on to the topic, so you all need to remember that each and every individual is different. No two person is alike. Even within the same family, each and every family member is different in nature. Their body structure, body type is different, likes and dislikes, everything is different. Given a similar situation to all of us, we all would be reacting to it differently. So today, whatever information I am going to share is based on general information, general knowledge, general data which is there available out there. But at the end of the day, ultimately it will depend upon your body type as to how you're reacting towards the entire process. So do not compare yourselves with your family members, with your friends, as to they are experiencing those things. I am not experiencing those things. So do not get confused, because might be as per your body type, as per your body functioning, that is normal for you. So next is, why do we need to talk about this subject? So still today, unfortunately, in India, periods is still considered a taboo in our society. We don't talk about it openly. But we need to remember that period is a normal biological process. Menstruation is considered as a normal biological process. Having a period actually means that our body is functioning normally. So we need to know about this. For a girl, for an adolescent who is just about to start with her periods, if she doesn't know anything about it, when she suddenly starts with her period, she would get afraid, she would panic, she would shock. So to avoid those reactions, it is why that we organize such sessions with adolescent, and also why with young women and other older women, is because related to menstruation, there are a lot of abnormalities that people do face nowadays. So if we know about the physiology behind it, the process behind it, maybe it would be easier for us to understand and take appropriate healthcare measures. So when we start with the period in our adolescent stage. So during the adolescent stage, mainly starts from the age of 10 years and it lasts till 19 years. So during this adolescence phase, we are hit with puberty. Both boys and girls, we are hit with puberty, and it is then that the adolescents go through a variety of physical as well as emotional or behavioral changes. So during this adolescent stage, when the adolescents are hit with puberty. So what is puberty? So puberty is basically a process wherein a lot of physical changes happen, and when the child's body matures into an adult body and one is capable of reproduction. So in more simpler terms, it is a time frame when the secondary sex characteristics develop, or in more simpler terms, when a boy turns into a man and a girl turns into a woman. So when we are hit with puberty, there are a lot of hormonal changes within us which stimulates these physical changes as well as the emotional changes. So for us girls, the puberty hits a bit early, that is around the age of 10 years. For boys, it is a bit late, that is around the age of 11 or 12 years. So it is in this stage, that is during the early adolescence, that there is when one grows very rapidly. And in terms of behavior also, if you notice, the early adolescents, they are very much curious and they have a lot of questions, and in terms of thinking, they have a very black and white concrete thinking without much room in between. And the early teens also struggle for independence. Then going on to the middle adolescent stage, that is from the age of 14 to 16 years. In this stage, the physical changes continues, but in terms of emotional behavioral pattern, or in terms of thinking also, if you notice, the adolescents actually go into a lot of arguments with their parents. So they want privacy, which they are not kind of giving. Also they are very much interested in the opposite sex, in romantic relationships. And in terms of also thinking, they are maturing, but at times when you see, especially in this age, there is a lot of confusion, that parents at times do tell them to act responsibly, act like a grown up, but when these adolescents do talk back to them, they're again reminded to talk as per their age, to behave as per their age. So this is a very confusing stage for them, like whether they are grown up or whether they are still belong, whether do they still belong in the childhood phase or not. Then going on to the late adolescent stage. So in this stage, mainly most of the relationships have stabilized. The children have come to terms with their own values and they are able to gauge the risks and rewards better. And in terms of relationship also, be it with their friends or be it with their family members, they have also stabilized. So talking about the physical changes that they are going through, or the adolescents do go through, so there are few common changes that happens with that the both boys and girls go through. That is the growth of height and weight. Then there might be acne problem, and also growth of hair in the pubic area as well as in the underarms. So there are some specific changes which the girls go through. The specific changes being the enhancement of breast, then girls start with their periods, and lastly the pelvic area also widens. And then the specific changes among the boys being their voice deepens, their shoulder broadens, there is the growth of facial hair, and also their private or the sexual organs also develops. So the male hormone testosterone is responsible for the development of the physical development among the boys, and the female hormone estrogen and progesterone are responsible for the physical development or the physical changes among the girls. So just as physical changes are important, equally are the emotional or the behavioral changes. So most of us are concerned with the physical appearance, but we need to keep in mind the emotional or the behavioral changes also. The behavioral change being, as some of which has been mentioned earlier, also the adolescents do become very emotional when they start to grow up. They tend to hold on to a particular emotion for a very long time. Also, the adolescents, especially the middle adolescents children, do suffer from an identity. So they look for people who are similar to themselves, and they get easily distracted. Also, there is peer pressure. At times, these peer pressure, that is they are always thinking what others are judging about them, and thinking about this pressure actually helps them to achieve in the academics and also in the extracurricular activities, but also at times they tend to take part in activities which are ought not to be done, or they themselves should do not want to do. Then there are mood swings. Well, we still have mood swings. We elders, the adults also go through a lot of mood swings, but the adolescents, especially the middle adolescents children, suffer. The mood swings are at the peak at the middle adolescent stage. At very small situations, very minor situations, they give a very loud reaction, and also their mood changes very quickly. They suddenly become very happy, next moment they become very sad, next very upset, then depressed, so without any particular reason. And lastly, they are very much concerned, the adolescents, or especially girls at your age or boys at your age, are very much concerned about the physical appearance. So the self-consciousness comes into take place. uh, People do tend to spend time in front of the mirror thinking how they will be looking, how they would look good. So that is known as self-conscious, or the self-love comes into take place. So coming on to the reproductive phase in a woman. So the very first time a girl starts bleeding is known as menarche. Okay, the very first time the girl starts bleeding. Before menarche, the body usually gives a sign that from this time onwards, or actually prepares the or actually warns the body that to be prepared. How it warns? It starts to secrete white discharge. So what is white discharge? It is a pale yellow substance, a slimy mucousy like substance which comes out of her vaginal opening. So it can be pale yellowish in color or clear in color, kind of slimy in nature. So when one starts to secrete white discharge, so I'm talking about girls who have not started with their periods. So once they start with their white discharge, they would know that within first time they will experience their period. So at what age do the menarche starts? So anywhere between the age 8 to 15, a girl can start with her menarche. There is no hard and fast rule that from this age onwards only one needs to start with their periods. There is an age range. The range is from 8 to 15. Any time in between 8 to 15, a girl can start with her menarche. So on what factors does this age depends upon, or the age of menarche depends upon? It depends upon the genes, the genetic factors, at which age their mothers or grandmothers started with their periods. It also depends upon their regular diet, the environment they are living in, their physical health as well as their mental health. Depending upon all these factors, will the age of menarche will be determined. So what is menstruation? So when asked to a lot of women to explain or just to tell us that what is menstruation, so the most common answer we get is that menstruation is the discharge of toxic or impure blood out of the body. But it is not the toxic or impure blood, it is just blood and mucosal tissue which is being discharged out of the body. It is the periodic discharge of blood and mucosal tissue. The entire process is known as menstruation, but since it happens periodically, it is known as periods. Okay. So, and many girls or many women do not have the idea, or they think that the blood which is being discharged out during our period is coming out from the same area from where we urinate. But that is also not the same area. So the female genital area actually has three openings. First is the urethra. Urethra is the opening from where we urinate. Next is the vaginal opening. It is from this opening that the blood and the mucosal tissue during our period is discharged out. And third is the anus, from where we excrete. So there are three separate openings. So the number of days a woman should bleed is from 3 to 7 days. So there is no hard and fast rule that one needs to bleed for this many days only. The range is from 3 to 7 days. The number of days a woman should bleed will differ from person to person, will differ from woman to woman. But for a particular woman, if she is bleeding for 3 days, she will continue to bleed for 3 days during the reproductive phase, unless and until there is a major change within the body. Again, one menstrual cycle may last for 22 to 40 days. That is, there is a gap, that is after every 22 days or 28 days usually the next period comes. So that menstrual cycle may last for 22 to 40 days. Again, it will differ from woman to woman. But for a particular woman or for a particular girl, the menstrual cycle will be fixed. That is the next period may come after 22 days, maybe after 28 days, or maybe even after 48 days. That is the normal range. So just as we start with our menarche within the age 8 to 15 years, there also comes a time when a woman ceases to menstruate, when the period stops permanently. That process is known as menopause. So menopause can happen anytime between the age 45 to 55 years. So when a woman approaches menopause, she will experience irregular periods, she might gain weight, she might forget things very easily, she might become very easily irritable, she might have hot flashes. So there are very many changes within the body when a woman will be going through menopause. Many women are capable to cope up with these effects, but there are women who can't cope up with these effects. For those, doctor's consultation is required. At times, even before the age of 40 years or above the age of 45 years, one experiences menopause, and that might be caused due to thyroid disorder, reduction, low levels of hormone secretion, enzyme deficiency, chemotherapy, or the surgical removal of ovaries. Also, at times, even after the age of 55 years, one continues to menstruate. So that is known as late onset of menopause, and that also might be caused due to thyroid disorder, obesity, high levels of estrogen secretion, or maybe due to genetic reason. So this is the female reproductive system. So it is with the help of this system that a woman is able to give birth to a child, and process inside this system actually leads to our periods. So the reproductive system is situated in the lower abdomen of our body. So in the middle we have the uterus. It is a kind of pear-shaped in nature and it is a muscular organ. Inside the uterus is a hollow space. So it is inside this space that when a baby is conceived or a baby is formed or the baby grows up within the pregnant woman, that the baby grows up within this uterus. So it is kind of elastic in nature. So when the baby grows up, the uterus can also expand, and when the baby is born, it again comes back to its shape. So attached to the uterus are two white pouch-like structures which are known as ovaries. So the ovaries contains eggs. The ovaries contains ovum or eggs. The female body contains around 10 to 20 million eggs. So we women are born with these eggs. It is not that it is developed later. We are born with these eggs and over the time it matures. So every month, alternatively from one ovary, an egg from the ovary is matured and is released, and through the fallopian tube. The function of the fallopian tube is to carry the matured egg from the ovary towards the uterus. So through the fallopian tube, it tries to come towards the uterus. Below the uterus, we have the vaginal tract, which leads to our external vaginal opening in our genital area. So the inner uterine lining or the inner wall of the uterus plays a very important role, and it is known as the endometrium layer. So what happens during our menstrual cycle, and why did I mention that the blood which is being discharged out is not impure or toxic in nature? So suppose if you are bleeding for 5 days, the first day of your period is the first day of your menstrual cycle. So after 5 days, when your period stops, then immediately after that the uterus actually starts to prepare itself for the possibility of bearing a baby. So how it prepares itself? The inner uterine wall or the endometrium, it starts to thicken. It thickens and it becomes enriched in blood and nutrients. Layers of blood are being lined up within the inner lining of the uterus or within the uterine lining. So while it is thickening up or preparing itself, simultaneously somewhere around the 14th day, an egg from the ovary is matured and is released, and through the fallopian tube it tries to come towards the uterus. So while it is traveling towards the uterus, if a sperm is met with the egg and if the fertilization process takes place, the fertilized egg will again travel towards the uterus and attempt to implant in the uterine wall. So at the end of the menstrual cycle, maybe depending on your menstrual cycle, maybe on the 20th day or on the 30th day or on the 40th day, depending upon your menstrual cycle, when the body will notice that the egg is not yet fertilized, then it will signal the uterus to shed the inner lining, that is the inner uterine lining, along with the unfertilized egg. So the egg will be disintegrated and along with the uterine lining, it will be discharged out of the body. So the blood which is being discharged out during your period is the inner uterine lining that of the uterus, that is the inner wall of the uterus, along with the unfertilized egg. So many of us do think a lot of blood loss has happened from our body, or a lot of blood loss happens from our body during our period, but it is not more than 2 to 3 tablespoons. The rest is all other kind of secretions such as endometrial fluids, microbes and discharges which is being discharged out, uh, due to which we tend to think a lot of blood loss has happened from our body, but it is not more than 2 to 3 tablespoons. So you need to track your menstrual cycle. You need to keep a record of your periods so that you will be able to know your menstrual cycle. So how will you do that? Of course, there are apps available in the smartphones nowadays. So if it is not accessible to you, you can take a calendar. Take any calendar and just mark the number of days you are having your period every month. So you need to do this every month. So once you do it every month, you will see, you will get to know the number of days you are having your period, whether it is of 3 days or 4 days or 5 days or 7 days, and also you will get to know the length of your menstrual cycle. How will you calculate your menstrual cycle? You will count from the first day of your menstruation in 1 month to the first day of your menstruation in the consecutive next month. So if you count the number of days in between, it will usually come in between 22 to 40 days, and that will be your menstrual cycle. So the average menstrual cycle is of 28 days, but it is not necessary that it has to be of 28 days. It can range anywhere in between 22 to 40 days. So what is the benefit of knowing these two? So if you know these two, you can stay prepared for your next menstruation or for your next period. And also if there is any irregularity noticed in the menstrual cycle, you may immediately consult with the doctor. So before our periods and also during our period, we go through a lot of mood swings. We don't like to socialize. We don't like to do anything. It can happen. I'm not saying it is with everyone, but few girls do go through this syndrome. It is known as the premenstrual syndrome. So it is mainly caused by the hormonal changes within us, which leads to this emotional turmoil. It can happen, it can also not happen. Both are completely normal. So when do you need to consult a doctor? So, or when does one need to consult a doctor related to periods? If a girl has started her periods before the age of 8 years or has not started by the age of 15 years, then doctor's consultation is required. If the menstrual cycle is delayed, early or irregular in nature, that is, one is experiencing her periods very early, before the menstrual cycle, or one is skipping her periods for more than days at a stretch, for months at a stretch, or one is continuing her periods for months at a stretch, or if the flow is extremely heavy, so heavy that one needs to change the pads every half an hour, or if the flow is so low that only one pad is required per day and there is only few drops of blood on the pad, so during those times doctor's consultation is required. Also, if one is experiencing a painful period, so some amount of pain is normal, but if that pain is extreme in nature, that they can't get out of the bed, can't eat, can't take a bath, then doctor's consultation is required. Also, if one is experiencing very heavy white discharge, so white discharge is okay before after your periods, 2-3 days is fine, but if you are having white discharge for the entire month, and if it is very heavy in nature, very smelly in nature, and if it is yellowish, brownish or greenish in color, and it causes irritation and rashes in the genital area, then doctor's consultation is required. So what are the menstrual abnormalities that are very common nowadays? So first is dysmenorrhea. So dysmenorrhea is pain during periods. Some amount of pain, as I mentioned, is normal. So why does that pain occur? So when the uterus is discharging the inner lining out of the body, so it mainly squeezes out the blood out of the body. So it contracts and expands. So when it contracts, It presses against the nearby blood vessels, which cuts off the oxygen supply to the muscle tissue. Hence, one experiences that pain. But when that pain is accompanied by nausea, loose stools, headache, dizziness, then it is caused by some other problem. Next is amenorrhea. Amenorrhea is the absence of period for more than 90 days at a stretch, and if unless the woman is pregnant or breastfeeding or going through menopause. So if a girl was not started her periods by the age of 15 or 16, or has not started her periods even after 3 years of breast development, then also it is known as amenorrhea. And then there is abnormal uterine bleeding, any sort of irregular periods, that is extremely heavy bleeding, extremely low bleeding, or that is early period, will come under the abnormal uterine bleeding. So why does these menstrual abnormalities take place? It can be caused by stress and lifestyle factor. If one is under extreme stress, or one's lifestyle is not very regular in nature, or is into excessive of exercising or dieting, it can lead to abnormal periods. Then if one has developed polyps or fibroids. So polyps are actually small growth within the uterine lining, and fibroids are small tumors which have been formed within the uterine lining. So the size of the fibroid can range from the size of an apple seed to the size of a grapefruit, and it can cause extremely heavy bleeding and also pain during periods. Then there is endometriosis. So when the inner uterine lining or the endometrium layer is formed on the outer walls of the uterus, it is known as endometriosis. It can lead to irregular periods, heavy bleeding, and pain during periods. Then there is polycystic ovarian syndrome. So it is mainly that small fluid filled sacs or cysts are formed in the ovaries, and it is mainly caused by hormonal imbalance, and it can prevent eggs from maturing, and so the ovulation doesn't take place consistently. So it can lead to obesity, infertility, and also excessive hair growth on the face, and acne problem. Then there is premature ovarian insufficiency, when one's ovaries is not functioning normally, and it can occur in parents who are being treated for who are being treated for cancer, or is going through chemotherapy, or due to the surgical removal of the ovaries. Also, lastly, there is the pelvic inflammatory disease, which is the which when there is an infection or an bacterial infection which has been caused within the vaginal tract or within the ovaries, or within the uterus, it can lead to irregular periods, abnormal menstruation, and pain during periods. So in order to get relief from the menstrual cramps, that is the normal menstrual cramps, we suggest one can try these 3 asanas. So it is extremely helpful and extremely beneficial for the reproductive system as well as the digestive system. So do a lot of research before doing the asanas, talk to experts, talk to your parents, and then do it. Always do it on the mat. Do not do it directly on the floor. So first is Vajrasana. So as you can see the picture in the slide, on the slide, one needs to sit in this position, and it helps to alter the blood flow and the nervous impulse in the pelvic region, strengthening the pelvic muscles, and it is also very helpful for the digestive system. Next is Shashankasana. Shashankasana actually stretches the back, realigns the vertebrae, and also strengthens the pelvic muscles, and it helps cools the pain and reduce anger. If one is experiencing high blood pressure, slip disc problem, or vertigo problem, one can skip this asana. Third is Marjari Asana. It improves the flexibility of the spine, neck, shoulders, and also tones the reproductive system. So third is the so pads are the most frequently used products or the frequently used product which is used during the period. So using a pad, uh, it actually prevents or keeps the vaginal area clean and dry. When using a pad, it also prevents staining on clothes, it also prevents infection, skin allergies and rashes. So if you are having a very heavy flow, you need to change your pads every 2 to 3 hours. If you are having a light flow, you need to change your pads every 4 to 5 hours. More than 6 hours, because if you wear a pad for a very long time, there will be bacterial growth on top of it, which can lead to infection. So the menstrual blood itself doesn't contain any germs, but when the blood soaked pad comes in contact with air, water or sweat, there could be bacterial growth on top of the pad. So please change your pads frequently. So just as we need to use pads, we need to dispose of the pads in a responsible manner. Do not flush it in the pan or in the commode, because it can block the pipes. You need to wrap it in the paper and throw it in the dustbin. Nowadays pads do come in an individual wrap. So please wrap it in the paper and throw it in the dustbin. So you need to maintain your hygiene properly during your period days. You need to use a pad which is soft and absorbent in nature. Try to use a pad which has a cotton cover. There are pads which has a synthetic cover on top of it. Please avoid using those pads because it can cause rashes. Soft cotton cover pads are gentle to the skin and it is much more absorbent in nature. Always take a bath at least once in a day during your period days. Keep yourselves clean, keep your vaginal area clean and dry. When washing your genital area or vaginal area, just use plain water. Do not use any kind of detergent, soap or any other kind of fragranced cream or lotion, because our vaginal area already contains a good bacteria which maintains the pH level, and if you wash it with soap or detergent, it washes away that good bacteria. Washes away that good bacteria, making it more dry and more prone to infection. Change your undergarments daily. Use cotton undergarments. Clean it, wash it, dry it, clean it, and dry it directly under the sun. It is only under direct sunlight will all the germs get killed. Always wash your hands before and after changing the pads. When using a public toilet, try to use an Indian style toilet because the point of contact is much less compared to a Western style toilet, and store the pads in a clean and dry area. So you people are matured enough, so one need not be saying that one's lifestyle does have an impact on the menstrual health, and it is a proven fact that smoking and alcohol does have an impact on the menstrual health, and it can lead to estrogen deficiency, it can lead to irregular periods, it can lead to infertility, and also one can reach early menopause. One can reach menopause at a very young age. So please use it responsibly. You need to maintain a healthy lifestyle. One needs to have a balanced diet. One needs to eat according to the color of the Indian national flag. So thereby all the required nutrients are ensured by the body. Please eat home cooked food. Of course, one need not be saying, or one need not be reminded that junk food is not very much healthy for the body. So having junk food or outside food once in a week or once in a month is okay, but having it regularly would cause harm to the body. At times during the period, one loses appetite, but do not skip the meals. Have it in small portion, but do have it. Do not skip breakfast. It is extremely important meal of the day. teachers, especially teachers, mothers do have a habit of skipping the meals. Do not skip meals. Have a healthy home cooked breakfast because it is extremely healthy and necessary for the body. Drink lots of water because it reduces bloating and the stomach acid level, which many women do face during the period days. So there is no such restriction as to do not have this, do not have certain fruits, or do not have certain food. You can have everything provided you are not having a problem. And there is no restriction because no food can actually particularly affect your periods. If you can have everything sour, sweet, or any type of food which is available, or fruits mainly which are available. If you are into exercising and sports activities, you can continue doing so even in your period days. It wouldn't have a problem. Okay. So if you're into exercising, if you're into sports activities, if you're not having any problem yourself, you can continue doing so. Actually, maintaining an active lifestyle health maintains the menstrual health. So we have come to the last slide, that is we still have some misconceptions to this day that women can't enter religious place, or can't enter kitchen, can't cook food, can't touch pickle. So I did mention, I did explain everything to you, the entire process. So it is up to you whether to follow it or not. So earlier in the days, there were no innerwears, there were no undergarments. So a woman used to do all the household chores. So when she did all these work, so there would be spillage, there would be staining on clothes. So in order to avoid those, they were prevented from doing these work. So nowadays, since so many products are available, so one doesn't have one doesn't have that much of a problem. So please you need so please maintain it regularly. Please maintain your health. So it is up to you whether to follow it or not. So we have come to the end of our session. If you have any questions, please feel free to ask. Any questions? Oh, I'm sorry. I don't
No,
think.
actually, madam has unmuted all.
Okay.
Yeah. Girls, do you have any questions? Madam, you can share the feedback form, Patil, madam.
Yes, ma'am. Okay.
It would be good to have any questions, any doubts related to it. Any questions?
Girls, any questions do you have?
Well, if not, thank you everyone. Thank you
Yeah,
for listening patiently.
madam, Patil, madam, you can
Yes.
give the vote of thanks.
Yes, ma'am. So before end of this session, I want to request all the participants to feel feedback about today's session. The link is shared in chat box. So on behalf of Women's Cell Bharati Vidyapeeth College of Engineering Pune, I want to thank Roshni Bhaumik ma'am and Miss Ankita Sukhwai ma'am for her valuable guidance about menstrual health and hygiene. I also want to appreciate her social work in this domain. At the end, I like to thank Principal Dr. Anand Bhalerao sir for giving direction to this event. At last, I want to thank Professor Kavita Kulkarni ma'am and Women's Cell Bharati Vidyapeeth College of Engineering Pune for successful organization of this event. Thank you all dear students and teachers for your participation. Thank you.